Physicians play a very large role in this. Regardless of what we do in the technological space, people still depend on their physicians, still trust them, especially if they've got a fairly chronic disease that's being managed for a long period of time. So it's really useful for us to engage physicians, make sure that they're part of this process from the beginning. And part of that, it begins even at the beginning of development and design of some of the mobile interventions that we have, so that we're involving physicians early in the process, understanding their workflow, understanding how we could best fit mobile technologies in and improve their workflow and what they're doing, and improve the medicine that they're providing. The other thing that I think we can do, we talked a little bit about the evidence that needs to be given. I mean, I think if if people go into physicians' offices and say, here's this really cool, innovative thing, wouldn't this be great? The first question they're going to have is, show me that it works. So we're going to need evidence. We're going to be able to show physicians, healthcare professionals broadly defined, how it works, what it does, what the evidence is that it's actually doing something. The other thing that I think is really important in this innovation component of this, and being able to diffuse that innovation, is trialability. I mean, the fusion of innovation model, has a number of things that talks about what works, what doesn't, how we can make this more effective. We need to be able to allow healthcare professionals to very easily try out new technologies, new innovations, see how they work, be able to try them for little to no risk from their perspective, no cost, that sort of thing. So they can try them out with patients, try them out in their practice, and see how they work and see how they do. Another is to see other people using that. I mean, for all the evidence that we have or don't have in the field at this point, one of the critical things for anybody to adopt a new innovation is that they see other people also adopting it. And so if people are in this sort of lone practice and they've never seen anybody use mobile technologies, they're much less likely to pick it up than larger practices, and especially ones like Cleveland Clinic and some other places where they're on the cutting edge of some of those technologies.